Hello and welcome back to our summer edition of Silvia's Health Hints. Today we are here in a beautiful garden. It's called Parco di Orticultura, and behind me you can see a very beautiful view over Florence. Today I would like to talk about the treatment of overweight and obesity, in particular about the treatment with semaglutide. I would like to talk about this because I have really a lot of requests for this drug. People are calling or writing emails that they are overweight and they would like to have this treatment because they heard of other people who did it and it worked very well. And so a lot of people are interested. That's why I want to clarify some points about this. Semaglutide is the ingredient because I don't want to mention the brands or the pharmaceutical companies. I don't want to do advertising for this drug. We have 3 products with semaglutide, which are produced by the same pharmaceutical company. 2 are injections and 1 are tablets. But only one of them, one of the injection version, are authorized for the treatment of overweight. The other 2 are only authorized for the treatment of diabetes. So, what are the indications for a semaglutide for treatment of overweight? It is number 1, obesity with a BMI over 30. Or overweight, which means the BMI between 27 and 30, and at least one other comorbidity, which means another pathology, another health problem, which is caused by the overweight. And then also to reduce cardiovascular risks, which are due to overweight. And last but not least, for overweight with a BMI over 27 in combination with our treatments. I think it is very important to make a complete assessment, a profound assessment before we prescribe this kind of drug, because it's not for everybody. First of all, I do normally a complete consultation, and I want to know the medical history of my patient. And then it is important to ask, for example, if this patient has always been overweight or became overweight due to some reason, to exclude also reasons that can be eliminated without the need of this pharmaceutical treatment. And it's also important, that's what I also ask my patients, what did they try so far to lose weight? Because then we can identify eventually errors, and can change strategy. Okay, how does semaglutide work? Semaglutide works on your brain, on the central nervous system, so that you have less appetite. You have less appetite, you eat less, you lose weight. It works only with a diet. It works only if you really eat less and if you do also physical activity. If you eat the same amount like before, semaglutide won't work. What is also very important that people are aware of this are the side effects. The side effects are pretty common, especially side effects which are gastrointestinal side effects like nausea, reflux, vomiting, abdominal pain, constipation, for example, and then also headaches, dizziness, and in some cases also hair loss. It's very important that patients are aware that the side effects of semaglutide are pretty common. So if you are interested in this kind of treatment, you should talk with your doctor. You should really evaluate your individual situation and if this drug really is the right treatment for you. Thank you for watching and see you in 1 week.